Hello and welcome everyone to another episode of You've Got the Power. I'm your host, Dr. Jason Deitch, and of course we're here with Chief Medical Officer of the Centeno-Schultz Clinic, Dr. Chris Centeno. Happy Monday to you.
Happy Monday, Jason.
We got an interesting topic for all of you joining us here today. Today we're going to be discussing and asking the question, what is BPC-157? And should you be taking it in order to enhance your healing? There's been a lot of conversation in Facebook groups, in the practice, people asking always about the latest technology. Does it work? Doesn't it work? Is it legal? Is it appropriate? Should people be taking this peptide? Doc, let's start off with sort of the highest level question, which is what are peptides and how should people be thinking about those as it relates to their healing?
Yeah, Jason, this has been a really big topic because, it seems like this is one of those things that on Facebook groups has kind of become a viral phenomenon. I think it started with a biohacker by the name of Ben Greenfield. Now, remember, this is the same guy who I highlighted in our blog that had injected stem cells into his own penis. So this is the guy who started pushing this BPC-157, called it the Wolverine peptide. So peptides are basically short little sequences of amino acids. So they're not yet big enough to be a protein, but they're similar. And in this case, really what you're dealing with is a growth factor. BPC stands for a body protective compound. It was initially found in the gastric juice, if you will, or gastric acid of humans. And the concept was that it could be one of those growth factors that help to help things heal. Now, in looking at it, if you look at the data that's available for this BPC-157 in the musculoskeletal system, all I can find is one or two studies that were done in the lab on showing how it can help fibroblast cells or tenocyte cells grow a bit better. But when I compare that to our data showing how PRP can help those same cells grow better, it really looks very similar to just adding PRP into those cells. So the data that exists for it is not really impressive. We have no clinical data at all. And then we get into the whole regulatory thing, which is a whole other set of issues.
Well, let's discuss. I mean, for those that are curious and wondering, well, maybe I should try it. There's the new term biohackers, for example, those people that sort of want to live either on the cutting edge or maybe the bleeding edge, depending on if you're right or wrong. Always looking for the new thing. It's one thing if you're an influencer with millions of followers and you make money doing these things. It's another thing if you're just trying to help yourself heal as quickly as possible. What are the regulatory issues? Is this legal for people to be purchasing over the counter? Should they be using it? Do you recommend it?
Yeah, so listen, there's some pretty significant regulatory issues here. And near as I can tell from talking to attorneys on this matter, regulatory attorneys, this is an illegal drug product. So what I mean by that is that if you're making a specific growth hormone, which is what this is, or growth factor, and putting it in a bottle, then that's a new drug that has to go through FDA trials in order to be sold. Now, how are the companies that are selling this stuff getting around that? They're either selling it orally as a supplement, or they're selling a research use only grade of this stuff that would be used normally in laboratories for laboratory experiments, but they're selling it clearly for human injection use. On the one hand, meaning the seller knows that's what it's being used for, but on the other hand, putting a lot of language on the website saying, this is a research use only thing. So that's how it's being sold. So it's in the regulatory, extremely sketchy land right now. And at some point, we'll probably see those loopholes get closed down. But the bigger issue would be safety. And the answer is we don't have any clue. We don't have any clue whether this stuff will help you heal like Wolverine or grow a tumor in your brain or do something else, meaning that the best laid plans of mice and men always tend to follow this same kind of pathway, right? As an example, we started using some new non-steroidal anti-inflammatory drugs 2 decades ago, and we engineered them so that they wouldn't hurt the stomach as much. But as it turns out, by doing that, we then dramatically increased cardiac sudden death risk. Now, no one who did the original lab experiments would have predicted that making a drug like that would increase the ability for someone to die of a heart attack, but it did. And I think we're in the same category here. We have an isolated compound, BPC-157. We have 0 data that's been published on the clinical safety of giving this isolated compound to people. You got to accept that risk, right? You don't know. Is it going to grow a brain tumor? Is it going to, if you've got cancer, make that cancer worse? You don't know any of that at all. So I would recommend people be extremely careful. And then if you look at the lab effects of this on musculoskeletal tissues, it's not any better than just doing a little PRP from your body. And for PRP in your body, I can rest my hat on dozens of randomized controlled trials with safety data in humans. So why would I expose my patients to this kind of risk? I would not.
That is always the question people are wondering is what's the best thing I can do for me? And of course, starting with using your body's own natural healing fluids, your own biology to heal yourself is usually a great place to start. And since your body made it, it's probably a good thing for you to use, especially under the guidance of experts like Dr. Centeno. Doc, we're getting a bunch of questions, so I'm going to start with those early. If you're watching, if you've got questions about BPC-157, now is your time to ask Dr. Chris Centeno. Let's hit some questions over here. This one was submitted in advance by Harry Liederman, who asks, my physical therapist told me that BPC-157 would heal my rotator cuff tear. Is that possible?
Yeah, we have no clinical data showing that BPC-157 would heal your rotator cuff tear. Again, we need to look at this now logically. So rotator cuff tears generally occur in avascular zones of the rotator cuff, meaning that there is no blood supply or there's poor blood supply there. So if you're injecting BPC-157 into yourself, or if you're taking it orally, it's going to have to get to that spot. And without blood supply, it ain't getting to that spot. So your rotator cuff, your physical therapist probably needs to go back to school to learn the very basics of rotator cuff tears, which tend to be avascular or poorly vascular. So the concept that you could take this stuff orally and it's going to help your rotator cuff tear is not real tenable. You're going to have to place something precisely in that rotator cuff tear if you're going to want that to heal. And that's a very common thing with a lot of injuries. They tend to be poorly vascular, hence the reason they don't heal on their own.
Such an important topic. And I have to say, it's so confusing for, normal people to know who to believe. This is really a trust and credibility issue. If you've built a relationship with your physical therapist, you think they're a good person, they've helped you in some particular way. Doc, do you have any, speculation as to why would doctors, physical therapists be making recommendations for these types of things that, as you're saying, you can clearly look in the literature and find that there isn't a body of evidence to support it? What do you think either motivates them, or why do you think they make these, I'll say, unsubstantiated claims?
It's interesting. To answer that question, I'll give you a story. I had actually gotten called by an attorney. I won't tell you where in the country this attorney is, but I know this attorney. He had called me because a local surgeon had prescribed BPC-157 to a professional football player. And Really, why did that happen? I suspect it was because the professional football player was asking for it, and the surgeon in that case wanted to keep that what he thought was a valuable patient, so he wrote the script. Turns out the compounding pharmacy that made the BPC-157 had a contamination of anabolic steroid that got into the BPC-157 vial. The guy got flagged on a steroid test and kicked off the team, and now wants to go back and sue the surgeon who prescribed it. The reason why I tell that story is that it's an interesting one on both the motivations that doctors have for doing things like this, but also the lack of control that we have over stuff like this. So that pharmacist, that compounding pharmacist, took a research use only product and then threw it in a vial for human use, which is totally illegal, and then apparently didn't bother to clean the tools that he or she was using to aliquot the BPC-157 properly, because those tools still had anabolic steroid from the last thing he mixed up, or he or she mixed up. So it's a good example of how careful you have to be with all of this stuff when you're taking research use only chemicals and then trying to turn them into drugs for human consumption.
I want to get back to everybody else's questions in a moment, but I have some as well that I just want to make sure that I take the opportunity to ask. I'm curious for your thoughts for our audience. How should people think, from your opinion, about the difference? I continually do my best to bring up the concept of using your own body to heal your body, what I think of as almost the ultimate personalized medicine, because it comes from you, made for you, versus many of these sort of outside, artificial, again, unsubstantiated chemicals made in pharmacies and factories and synthetics, those types of things. How should people, just generally speaking, think about it? We tend to not trust our body, not trust nature, not trust the natural process over, scientists and researchers anywhere in the world who are trying to come up with some sort of discovery that's going to ultimately, obviously, make them famous and rich in most cases. How should consumers think about that? What do you believe priority-wise? Should people be defaulting to letting the body heal itself and using natural methods first, exhausting those methods before starting to turn to these, I guess I'll call artificial outside-in types of methods? Or what do you recommend in terms of just philosophically how to process information? Because there's so much that comes out, BPC-157, 158, 159, it's all like technical numbers. But philosophically, how do you believe that people should be thinking about that?
Yeah, so I think a simple concept is to say, listen, if it comes from my own body, that comes with a level of safety. And so that's most likely to be safe until proven otherwise. If it comes from outside of my body, then that's less likely to be safe until proven otherwise. But if it's a natural substance, let's say a whole natural substance like honey, that has some track record to it, then that's more likely to be safe. But if we're isolating specific components of the body down to the peptide level, we don't have any idea what happens when you dramatically increase the amount of that peptide or hormone or whatever that is in a human person. Now, there are certain ones out there like testosterone, human growth hormone. Those are FDA approved. We have lots of information about what happens with those when they're used in people. So the doctor can guide that and use those things off label. But here we're not even talking about off-label use. We're talking about something that is isolated, that has never before been tested in humans in a rigorous controlled trial of any type, and that is completely unknown. So that would be the highest risk thing you can do. The only thing higher than that would be to make a completely different thing that doesn't exist in nature at all, and then try to put that into a person without any controls. So we're not talking about a supplement here. We're not talking about something that is natural, because this BPC-157 doesn't exist like that. And I would also challenge the concept that there's even BPC-157 in most of this stuff that's being sold. You know, you saw what happened to the football player that tried this stuff. Turned out the pharmacist did a poor job of mixing it up because there aren't those same controls that you have over prescription drugs. So just be really, really careful. But that's how I'd look at it. Stepwise progression of something that comes from my body, something that's whole and natural that comes from someone else's body. Obviously, you need to look at rejection issues there, and then go up from there into this world of I chose this random peptide, I dramatically increased the amount of it, and now I'm going to inject that back into my body. Who knows what that does?
Such an important topic. I hope all of our viewers are really hearing that nature knows. I mean, you think about the miracle we are. We get disappointed sometimes. We're like, wow, this hurts. Why doesn't it heal itself? The trauma we do, the chronic micro traumas and so on cause these types of injuries. But nature knows. Let's not forget that. Okay, let's keep going to questions. We've got Diane McCracken who says, GHK and GHK-Cu are used by some people to try to improve spinal stability. Some people who take GHK-Cu have gone copper toxic. How might copper toxicity affect stem cells? And do you know if being blue indicates that the copper is toxic?
The person blue? Hopefully we're not talking about a person that's blue.
I got a feeling that is that's my interpretation of the question. Diane, if you'd like to clarify that, please do.
Yeah, again, I think we're in the same world here. Is that we don't know what this does in people. And there's one thing to rub this stuff on your skin, which is the only, well, again, the FDA has a more lax standard for things that are rubbed on the skin, unless they're dramatically absorbed into the body. But in this case, we're talking about taking something that is sold to rub on the skin, and I hope people are not ingesting this or injecting it into their body, because there is no FDA approval for GHK at all. And if they are, it's a copper complex. So if they are turning blue, then that's a very, very serious issue.
She did indicate on the notes that she meant the substance turning blue.
Well, copper is blue in liquid, or in its liquid form. So if it's a copper complex thing and it were blue, that wouldn't be surprising. But just again, be really careful, because we've got no FDA approval for this. We have no idea what happens when it's introduced into a person with a clinical trial showing this works, doesn't work, and here are the possible complications of it. So I would never in a million years prescribe this stuff for my wife or my son or my daughter.
All righty, there you go, Diane. Thank you for your question. We appreciate you watching. Megan May, a regular viewer. Hi, Megan. She asks, this is off topic, but I have severe elbow and knuckle pain from years of iPhone and computer work. Knuckles have red or discoloration on the skin above. Can stem cells help?
It depends on what's causing the knuckle pain. If what you're saying, if you've got osteoarthritis in those joints, then we'll commonly use PRP, sometimes bone marrow concentrate, to treat that osteoarthritis. Now, if there are other things that are causing the knuckle pain, and the thing that makes me think that is the redness, like an inflammatory arthritis, then that may be a different story. So I think I need to know more about what's causing the knuckle pain.
There you go. That is essential to know. And again, that's why you really benefit by watching this show and taking those next steps. Dr. Centeno and everybody at the Centeno-Schultz Clinic are still available for telehealth clinic. So if you've got questions about your specific condition, like this just now, now's a great time to reach out to the Centeno-Schultz Clinic, and you can get your specific questions about your diagnosis, what you're going through specifically, handled via a telehealth consultation with somebody at the Centeno-Schultz Clinic. Let's keep on rocking. We've got Kara Vogel, who says, I know BPC-157 can be helpful for muscular and tendon injuries. Would it help a disc injury to heal after an intradiscal PRP treatment?
Yeah, nobody knows whether BPC-157 can help tendon or ligament injuries. There is no published data on human use at all. I know because I've looked for it. We have a lab study that shows that it seems to help tendon cells heal, but how that translates into an actual human, no one has any clue. So right now we're starting with the idea that BPC-157 is a complete unknown when it comes to helping tendons or ligaments heal. So that's the starting place of reality versus the hype. Then we get into, can it help someone's discs heal? Discs, again, we get into that same avascular conversation that we had before, and that is if we're talking about an area like a disc that's avascular, meaning it doesn't have a blood supply. So the likelihood of getting the BPC-157 from an injection or orally into the disc is slim and none, and Slim's on vacation in Texas, meaning that it's not going to happen. That's why those discs fail, is because they become avascular. They lose their normal nutrition through what's called imbibition or lack of imbibition, and then they can't be nourished by the body. So now maybe injecting BPC-157 into the disc might help, but that's a completely medically irresponsible thing to do. And if I had found that one of my colleagues did that and got asked by the medical board as to whether he should keep his license, I'd say he should lose his license.
Kara, I hope that answers your question. We thank you for asking it. That's what this is all about. Megan May goes on to ask thoughts on L-arginine and other amino acids. And she might be asking relative to the, I guess, knuckle pain, elbow pain that she was referring to a few moments ago would be my connection, my guess on her connection.
Yeah, I would need to know a lot more about what's happening with your knuckles, why they're hurting, et cetera. So I don't think I can answer that one.
Do you want to make any comments about arginine and amino acids in general?
Yeah, I mean, the concept with arginine is it's supposed to help reduce nitric acid in the body, but again, we have no clinical research on this. So this is a theory that L-arginine will reduce nitric acid, or nitric oxide, sorry, which can be which is one of the things that can cause pain in chronic injuries and cause other issues. But we only know that it does that through experimental studies in reducing nitric oxide loads. We don't know what happens when a human being takes that and that has a specific injury.
All righty. Thank you, Megan. I hope that was clear, and thank you for your question. Let's move on to Ryan Burkeen, who says, thoughts or insights on the carnivore diet during regenerative medicine treatments?
I think you would be referring to perhaps a high protein, low fat, and low carb diet. I think that would be fine.
Okay, there we go. Thank you for your question. Adrian Cuvion Barnhill, also a regular viewer. Hi, Adrian. She goes on to say, my last PICL, I had blood drawn after my stem cell draw. This time I scheduled for blood draw an hour before stem cell draw, and I'm concerned about the blood draw reducing the volume of my stem cell draw and putting me at risk for getting a lower TNC count. Should I be concerned?
No. So your blood, so blood draw would have no effect on TNCC. So total nucleated cell count for a bone marrow aspirate. Also realize that we've been increasingly getting everything we need for blood products like PRP or platelet lysate from the bone marrow aspirate itself, and just taking extra bone marrow aspirate in a type of bone marrow aspirate that draws preferentially from the peripheral blood circulation. So, but as far as giving blood first and then a BMA, there should be no effect on the bone marrow cells at all there.
All righty. We've got also regular Stacy Kaufman. She asks, any thoughts on increasing collagen levels by drinking bone broth and taking high levels of vitamin C?
I don't think anyone knows that clinically. There's nothing wrong with that. Obviously, bone broth would be a low risk thing. Vitamin C would be a low risk thing. Unlike some of these other things we're talking about, where we're isolating specific peptides, where people have no clinical experience, we've got reasonable clinical experience with people obviously eating bone marrow and bone broths, and lots of clinical experience with vitamin C. So I think while we have no data, it's certainly reasonable to try to see if that's something that might help you.
All righty. Thank you, Stacy, and thanks for watching. We have Adrian once again says, I read a study that resveratrol can be stem cell toxic at lower doses, but beneficial at higher doses. I don't remember the values right now. What dose is in the stem cell support formula, and how did you choose it?
Yeah, there's no data of which I'm aware that says that resveratrol in low doses would be toxic to mesenchymal stem cells. We chose the dose that we chose for that based on lab studies that we did with mesenchymal stem cells. But there's no data of which I'm aware that shows that low doses of resveratrol would be toxic to bone marrow mesenchymal stem cells, which is the target we're talking about here.
All righty. Do you want to talk about the stem cell formula that you do recommend on a regular basis so people who may not be aware of it become aware of it?
Sure. So that stem cell support formula took a bunch of natural ingredients where we've got loads and loads of clinical published data on those natural ingredients and looked at their ability to help mesenchymal stem cells do their thing. And that's how we formulated it. Now, since then, there's continued to be lots of publication on many of the agreements or ingredients in there. One of those, for instance, is curcumin. Curcumin and turmeric have had a huge amount of clinical publication in the last decade as anti-inflammatories, and in fact, even head-to-head trials with things like non-steroidal anti-inflammatory drugs and other prescriptions for being equivalent to the anti-inflammatory ability of those drugs. Everyone should know that we are in the middle of a randomized controlled placebo trial with the stem cell support formula. So if you've got knee arthritis and you're interested in participating in that trial, then contact us. Aaron Dotson is our clinical research coordinator. And in that trial, you'll get a bottle of either placebo made to taste just like that or the real deal. You'll take it and then you'll fill out questionnaires about your knee pain. And then if you turned out to be in the placebo group, we will give you a bottle of the real stuff for free. So there's no cost to participate in that trial if you're interested and you qualify. So that's something you might consider if you've got knee arthritis, and you'll end up one way or the other getting the real deal to try.
I'm going to follow that up with, again, for those who may or may not have that issue and want to be part of research, who should be, in your opinion, taking that stem cell support formula, and where would you recommend that they get it from you?
So that's something you can get at the clinic, or you can order it online on our website. So either one. And the stem cell support formula is really for two different reasons. The primary focus for taking it pre and post procedure is to reduce that chronic inflammation that a lot of us get as we get older and we struggle with. That's the same chronic inflammation that can cause heart disease, et cetera, but it also affects your joints. And then another reason to take it is we've got a lot of patients who started taking it because of that, and they find that it makes their joints feel better, so they continue to take it because it's got a lot of good anti-inflammatory stuff in it. In fact, in the randomized controlled trial, we're measuring its ability versus a placebo to reduce knee pain.
Outstanding. So please contact the Centeno-Schultz Clinic if you're interested in that, or go to the website if you'd like to check out the benefits of that. Adrienne makes the comment, she goes, I'm an RN and I certainly don't know everything, but when I hear red knuckles, I think are as in rheumatoid arthritis. Any comment from you, Doc, or you alluded to that earlier as well?
Yeah, that's what I talked about. Inflammatory arthritis is something that probably needs to be ruled out because there's a whole host, including RA, of inflammatory arthritises that will not only just cause, knuckle pain. I've got a little bit of osteoarthritic knuckle pain there. But when you get the redness associated with that swollen joint, that's when you really got to get it worked up by a rheumatologist or someone in the know for an inflammatory arthritis.
All righty, so please get that checked out. We have M.L. Hale, who asks, would stem cell or PRP be helpful for overextended ligaments that lead to chronic dislocation of ribs?
Yes, I mean, normally, so there's two different kinds of people that have those issues. One is where there's been trauma and the person is otherwise has a normal musculoskeletal system. And a lot of times that could be things like auto accident trauma. They've taken some sort of blow to the chest or the ribs, in which case we can go in usually and tighten down the fascia around the ribs and where the ribs attach to the spine using injection of lots of different things, including PRP. The other would be if someone has severe EDS or very stretchy ligaments, in which case they may just be born with an inability to control the motion of those ribs because the ligaments are just too loose. And again, trying to tighten those down can make a big difference there as well. So we treat lots of patients with dislocating ribs, but they tend to fall in one of those two categories.
ML is clarifying that it was from an MVA, motor vehicle accident.
Yeah, very, very, very common thing that we treat.
Excellent. Thank you, ML. And again, something you should probably reach out to the Centeno-Schultz Clinic to get more specific information about you. You can do that either with a telehealth conference or you can schedule an appointment with the doctors directly. Adrian follows up. She says, I may not have worked my question well. So let's try again. So would there be an effect on bone marrow aspirate volume if I do my blood draw first? Dr. Schultz said I was a, quote, slow draw last time for bone marrow, so I want to be sure that I don't exacerbate that or in any way impact my stem cell draw.
Yeah, so just realize that this may be a moot point now simply because what we've moved to as a clinic is getting the blood products from the bone marrow aspirate itself. So that's probably the best thing to do there because that'll get rid of the issue altogether. Is just talk to Dr. Schultz about increasing the bone marrow aspirate enough to get your all your platelet needs met. Because when we're doing a separate blood draw, we tend to do that because we want to get PRP made or get platelet lysate made or platelet poor plasma. So that's being taken from standard blood draw. But now we can get all of that from the BMA itself. So what happens there is the doctor does his traditional BMA to maximize stem cells and then has another request of, let's say, taking an extra 60 cc's. Now that's taken very differently. That's taken from a single site with a high volume draw because really when you do it that way, you're just taking peripheral blood anyway. So it saves the patient a stick and it's much more efficient. Obviously for our clinic, and it will get rid of this whole issue of before or after peripheral blood draws. So just talk to Dr. Schultz about the concept that you want everything taken from the bone marrow aspirate that you will need, and it will get rid of this altogether.
Excellent. We still got lots of viewers and lots of questions. I'm checking to make sure you've got lots of time. You're okay on time?
Yeah.
Great. Okay. Diane McCracken follows up with, how important is omega-3 to preparing for the PICL?
Again, I think what we're talking about there is in the class of anti-inflammatory supplements. So just realize that many of us as we get older, or if we're infirmed or we're sick or we're not active, our baseline and systemic inflammation tends to ramp up. And systemic inflammation plus healing equals less efficient healing. So if we can get that down through various supplements, including fish oil, omega-3s, curcumin, glucosamine, chondroitin, all of those are anti-inflammatory supplements that reduce systemic inflammation and have been shown in clinical trials to do that. So those are all good things to take with this type of procedure because we want to get that systemic inflammation down. But that's the reason for taking them.
Excellent. All right. We've got Livia Benko who says, hi, I just got the PICL. My previous jaw issues started getting slightly worse since. Can jaw issues worsen the CCI itself, or can the jaw get better if the neck gets more stable?
Yeah, you have to realize that the jaw and the upper neck are very much linked. So what happens is when you've got upper neck issues, the stabilizers there go offline, and so you tend to use these anterior stabilizers that are hooked into the jaw to help stabilize your neck. Now they're not designed to do that. So I would imagine in the post-inflammatory portion of the PICL, meaning when you're in that first, let's say, couple of weeks or month where things are aggravated and the upper cervical stabilizers are off because of that, then your jaw could get more pressure. Now, many times we need to treat the jaw separately, but realize that there tends to be a big relationship between upper cervical problems and the jaw. And if the upper cervical spine gets better, the jaw perhaps will get better if it has not established a life of its own, meaning damage of its own beyond what's happening from the overload from the upper neck. So that's going to need to be looked at by your doctor, obviously.
Outstanding. Last call for questions. We normally go to the half hour, but when we have questions and Dr. Centeno has time, we'll go a little bit longer. So this is our last question, unless we've got more questions that come in right now. Megan goes on to ask, thoughts on colostrum supplements separate from knuckles? It's an immune system supplement. So she's not asking specific about her arthritis or anything like that. Generally, your thoughts on colostrum supplements?
You know, I'm not an expert there, so I don't want to get into it. It's not something that I've used in my practice, so I don't want to wade into an area where I don't know a lot.
All righty. Well, that's what we have for questions right now. Today's topic is all about BPC-157. Should you take it? You may see it in groups. You may have seen people talk about it, influencers promote it, athletes even saying, or even physical therapists saying that it's a good thing. But Doc, you want to summarize today's topic and go from there?
Yeah, so BPC-157 is a peptide compound. And listen, this could turn out to be the best thing since sliced bread in another 10 or 20 years once it's studied in humans. It's being sold illegally right now, classified either illegally as an oral supplement or classified either illegally as a research use only injection. So be very, very careful with this because there's a number of problems that come with that illegal sale. One is obviously no one's regulating it at all. Number two is you don't even know if there's BPC-157 in what it is that's being given to you. And then number three is you don't have any idea of what the effects of high doses of BPC-157 are on the human body. So stick with something that comes from your own body to try to treat this stuff. I don't take BPC-157. I wouldn't recommend my wife take BPC-157. I wouldn't recommend my son or my daughter take BPC-157 because of our lack of knowledge on it. And just because a biohacker or some social media person is pushing it, or you're seeing people in groups that are paid spokespeople for certain folks that are selling it, pushing it, be very, very, very careful.
All righty. Let's, Stacy Kaufman says, thank you. Diane McCracken says, thank you for doing these talks. They're very helpful. You are very welcome. We appreciate it. We love doing what we do, and that's why we do it. Our only request is help us help more people. If you know people that should be tuning in and watching, please, you can actually type their name in the comments. Usually it will bold, which means you're tagging them, and that's the easiest way to let people know about this show. You can also click the share button right there. So either way, whether it's your friends, family members, your doctor, other people you know, maybe your physical therapist, who knows? But have them tune in, and that way they can ask their questions directly from the source. The doctor I call the Elon Musk of regenerative medicine, who invented many of these procedures and has been doing it longer than almost everybody out there. If you'd like more information, the place to go and the thing to do is to reach out to the Centeno-Schultz Clinic and either set up a telehealth conference if you're not local to the Boulder Clinic, or make it into the Boulder Clinic and find out more about your specific condition. Of course, we can answer questions here in general, but nobody can diagnose over the internet. So find out your specific information about you first. And if you'd like more information about the stem cell support formula, that's also the place to go. Again, the Centeno-Schultz Clinic in person or online at the website. That is our show for today. We appreciate it. If you've got questions or comments, leave them down below. Otherwise, we will see you right here next Monday, where we'll go over more of these fantastic topics and details. On behalf of Dr. Chris Centeno, I'm Dr. Jason Deitch. We really appreciate you tuning in with us each and every week. We love when people learn more about how to take your power back, how to navigate your conditions, how to self-manage, where to go, who to trust, what questions to ask, how to think about these crazy questions when it comes to healthcare in this super complex area. Even doctors get confused sometimes. So it is essential to get the facts, find people you can trust, and stay connected to them so you can get your questions answered on a regular basis. And I'll just close by saying, if you are curious, make sure you ask about the Proactive Membership Program. Proactive members at the Centeno-Schultz Clinic do get the stem cell support formula as part of their membership. So make sure you ask about that Proactive membership when you reach out. We thank you for watching. Hope you had a great Father's Day yesterday. Have a great week, everyone. We'll see you back here next Monday. Thanks for watching, and thanks for sharing the program with your friends, family, and others. See you next Monday. Thank you for watching. Stay well and be kind.